Hey, everybody. Just going to give it one quick second here as people are coming in. I'm probably going to be moving the camera around a little bit. I want to make sure you guys can see my feet. So we'll move it around a little bit to make sure throughout the workshop. All right. So let me just welcome you. If you guys don't know who I am, my name is Jenna. I am the owner of a physical therapy practice called Pointe Wellness and Rehab. So my specialty is dancers. So I wanted to put together a workshop for you guys. One of them I had polled on Instagram, and one of the most common things people had asked for was some ankle strengthening, some stabilization issues, different things like that. So wanted to give you guys a workshop on that today. We're going to be going through kind of some functional exercises and a functional take on the strengthening component. So we're not going to be doing just your standard TheraBand exercises, things that you might have seen like in a pre-Pointe class or whatnot. They're all great exercises, but I wanted to give you guys a little bit more of a functional take on it. So we're going to be doing some higher level exercises, things that are more in a weight-bearing position, and can give you a little bit more bang for your buck, basically. The other thing that I wanted to just kind of let you guys know is it's hard to fill an hour with only so many exercises. So I wanted to make sure that I gave you guys as much information as possible in this hour, but of course, still don't feel like it's enough. And one of the biggest issues that I find with people is the carry through, right? We do workshops, and I think, it's great for the time being, and you probably keep up with those exercises for, I don't know, a week, 2 weeks, maybe 3 weeks if you're really good about it. But after that, what I find is a lot of people just stop doing them. And the reason I think that happens is because you don't really know how to implement them. You don't know how to use them in your day-to-day life. How do you create a program with it? And so that's what I did for you guys. So I'm only offering this to anybody that's been registered for the workshop. But I did create a 4-week strength and conditioning program specifically targeting ankle stability and strength. So it is for purchase, but it's low cost. So it's $11.99. And again, it's a 4-week program, and it gives you, it cycles through 3 different days. So in a given week, there's 3 workouts. You can space them out however you need to space them out. And each workout will include some stability exercises, some strength training exercises, and then some mobility exercises. And I think there's no more than I want to say 9 exercises per day is like the most amount. So they can all of these programs can be done within probably 20 to 30 minutes. And I did that purposely knowing that you guys are busy and you're in and out of classes and Zoom classes right now. And it's hard to make sure that you can keep up with the routine. And so I wanted to make it very streamlined and easy for you. So I just went ahead and created that program. So again, it's $11.99. It's for sale. I'm going to link, so you guys will get an email after this with the link to purchase it in it. Again, I'm only offering it to you guys that are part of the workshop, because a lot of the exercises that we do, basically I'm taking what I'm going to show you today and I put it into the actual program for how you can implement it. So whether you're watching this live or you're watching the replay, it'll still be available to you. So I do really hope you guys will take advantage of that. Now is really the perfect time to work on some stability programs. So, okay, so we're going to get started. Again, kind of the goal of today is to go over some stability training and strength training exercises to help you be able to dance a little bit more confidently on the ankles. So this is really good if you are somebody that has, a history of like recurring ankle sprains, or so recurring ankle sprains or past surgeries or sprains or strains in the muscle or any sort of injuries, that's going to make you predisposed to some ankle instability. So if you're somebody that falls into that category, this will be perfect for you. This is also perfect for you if you are a dancer that is either currently dancing on Pointe or looking to go on Pointe in the near future. It's a great training program to get you to that point. So let me know over in the comment box there. Just give me like a thumbs up or something, or yes, if you are somebody that has history of an ankle injury or pain or anything like that, because that'll kind of help me as we're going through the exercises to know how many of you guys actually have an issue. The other thing, I should just put a disclaimer out there before we start, that this is not meant to supplement any physical therapy, okay? This is not going to be a customized program in any way. This is just some general strength and conditioning for you guys. And so you should never use this to take the place of needing to go in and see a physical therapist or a doctor or healthcare professional. So make sure that if you do have an issue, that you seek out help from a local professional, and you can get the care that you need. Of course, if you're in Virginia, I am more than happy to help you guys out, but I'm only licensed in Virginia, so that's about as far as I can take my physical therapy. Okay, so it looks like we do have some people with some instability, hypermobility. Yeah, okay, so this will be perfect for you. All right, so just a really quick basic rundown of the ankle. Okay, I'm going to give you a little anatomy background because it'll help you with the exercises. So we have two main groups of muscles that we're looking at. We have what's called the foot intrinsic muscles, and then we also have what's called extrinsic muscles. So the intrinsic muscles are the little muscles that are right inside of the foot. Okay, you've got a lot of little muscles in the foot, and they're between each of the little bones and joints. And so that is anything. So in the foot is an intrinsic muscle. Okay. And so when we do some of the strength and stability things are purposely meant to strengthen just the foot and just the intrinsic muscles. The extrinsic muscles are things that are external to the foot. So those are the muscles like up in the calves that carry down. So the muscle bellies are up in the calves, and then it comes down and it turns into tendons, and those tendons are what connect into the foot. So anything that is external to the foot is an extrinsic muscle. So we are going to cover exercises that will do both of those muscle groups, and some of them will be a combination in the same exercise. Basically, though, when we're looking at, so if we talk about these external muscles, so the calf muscles, we have in the ankle we call them the stirrup muscles. And so basically, I'm just going to angle this down a little bit here. Okay, so basically these stirrup muscles are on either side of the calf. They come down and they loop right around here. So they create a stirrup around your foot. And so if you want to know the terms, okay, so the fancy names for the muscles are, we have the peroneals on the outer side of the calf. And then on the inside, we have what's called your posterior tibialis muscle. Those create the inner and outer stability in the ankle. So we want to make sure that they're nice and strong. So as you do things like a plie or going up into releve, they're creating some of the stability for that side-to-side motion. The other muscles that we're looking at are like on the front of the foot, we have what's called the anterior tibialis, and that's going to control some pointing and flexing, as well as the gastroc, which will help control pointing and flexing. So the front, the top and the bottom are more the point and flex, and then the inside and outside are more for the in and out. So the winging, the sickling. But we have to have good stability and control around all sides of the ankle, right? We have to make sure that we have enough strength in all parts of that to create movement that is symmetrical and even, and that there's no compensation, which can be what leads to injuries. The other thing that we want to keep in mind, looking completely outside of the calf and the ankle, is where else are you getting stability from? So we take that all the way back up to the knee, and most importantly, the hips, okay? What I find in a lot of my dancers who have recurring ankle sprains and a lot of instability in the ankles, yes, we have to strengthen the ankle, and that's really important. However, if I come up to their hip, strengthen their hip, most times I find that there's a significant amount of weakness in core muscles. And the reason being is those are your stabilizers. You know, your core is your powerhouse. So if you don't have a good stable core and use of your turnout muscles, that weakness is going to carry down all the way into the toes. So it's really important that we strengthen not only the ankle itself, but come all the way up the chain and talk about the core and the hips as well. We are going to get into I'm going to show you a couple simple hip exercises today. We're not going to get into the nitty gritty of that because that's a whole other topic, which we will get to. There will be another workshop on the hips, don't worry. But we really are going to talk mostly about the ankles today. So the most common injuries that I tend to see in the ankle are kind of what we've talked about, instability and hypermobility. So that's just like extra movement and a lot of flexibility in the ankles, which can result in not enough stability and strength. It can also lead to sprains and strains. So a strain is in the muscle. That's when you maybe overstretch one of these muscles higher up in the calf. It can happen in the foot as well, but usually it's like these tendons in the ankle itself. You overstretch the muscle and we end up with a strain. A sprain is when you overstretch the joint, so the ligament is what gets affected. And basically all a ligament is, it's a small piece of tissue that doesn't contract like a muscle, but it connects bone to bone. So that's really going to provide you a lot of stability in the ankle joint. And so when we sprain the ankle, we automatically loosen that ligament, and you can't get the stability in a ligament back once you've already sprained it. So it becomes really important that we strengthen the surrounding muscles to take up the slack for where we're now lacking in the ligament itself. So that is a really important thing to keep in mind. If you have had ankle sprains, just strapping a brace on there isn't going to do the job. Okay, you've got to strengthen the muscles to take up the slack for where that ligament has been overstretched. I would say the other thing that I see a lot would be like stress fractures, or you can get avulsion fractures, which is basically like you overstretch the muscle and the ligament, it could be ligament or tendon pulls, and it pulls a piece of the bone off. So it actually fractures. So sometimes you can get an avulsion fracture. Stress fractures, I think, are a little bit more common in the foot itself. So all of these exercises will help any of these issues, okay? Or at least help lower your risk of having one of these injuries. All right, so getting into some of the movement things. First off, the most important thing is that we start to kind of talk about what should alignment look like. If we know what alignment should look like, that's going to then carry through to actually doing the exercises. So when we look at the foot, we have two directions that are kind of important that we want to keep in mind. One is supination, which is this direction, and the other is pronation, which is that direction. So the arch falling down, okay? Supination is this way. Pronation is the arch falling down. This is the one that I usually see the problem with in my dancers, is that arch falling inward. And we know in dance, of course, that we want to have a nice, pretty arch in our feet. So how do we actually make that arch? Well, we talked about those stirrup muscles. Those stirrup muscles come into play here. They're really important for maintaining the arch in the foot, as well as those little foot intrinsic muscles that we talked about already. Those also help create the arch in your foot. So it's a combination of strengthening intrinsics and extrinsics, which will help you maintain the position in the foot. This will carry through to your dance technique, as well as just everyday, day-to-day life, and the exercises that may not be as dance specific. So the first exercise that I want to show you is for alignment. And then from that, we're going to carry it into most of our other exercises. So you may have heard this before. It's called doming. Okay. So doming is basically being able to create the arch in this foot so that we're not pronating and flattening down. Okay. Now, if you guys watched, I think on Instagram, I had posted, we did a post about doming, and there was a link to my YouTube video on this. So you may have already heard some of this. We are going to go through it again because it's really important. But basically with doming, our goal is that we're trying to cinch up the center of the foot. So I'm trying to, sorry, I'm on carpet, so it's a little bit harder to see here. Let me come a little closer. I'm trying to move from a flattened or sometimes pronated position to pulling up on that arch. And when I do that, you'll notice my toes, they're not curling, right? I'm not making an arch by curling my toes. That's a really important distinction here. This uses the wrong muscles, okay? What I'm actually thinking of is this first metatarsal here, this first bone. I'm almost, when I do this, I think of pressing that bone down into the floor to try to scoot it back closer towards my heel. So it creates that cinched up position there, okay? And so just working that and trying to keep the toes flat, that's the most important part. The other thing that you want to pay attention to, because this is an exercise specifically for the foot intrinsics. So we want to pay attention to, am I getting, I don't know if you can, hopefully you guys can see this, these tendons on the top of my ankle, I don't want them to pop out, okay? If I get the tendons popping out, what that tells me is I'm using a lot of the muscles up here, right? Because the tendons are apart from the calf muscles. Okay, so I want to try to get that dome without the tendons popping. So there they are popping. There they are relaxed. Oops, sorry. There they are relaxed. Popping, relaxed. Okay, but I can still maintain that dome. I want to try to get that dome to happen from the muscles within my foot. So trying to keep those extrinsics relaxed is really important. And it's hard to do, okay? This takes a lot of practice. So the best thing I can tell you is just practice this one all the time. In the 4-week program, this is in there throughout all 4 weeks. It's probably the only exercise that is carried on throughout all the 4 weeks. Well, I mean, there's one other, I think, but they're both really important for alignment. And it does take a little while to get this. So the reason that this then becomes really important is we want to pull this into your dancing, right? That's the whole goal here. So when I do I'm going to stand up here, okay? So when I do my doming, sitting is a lot easier because I don't have my weight through my feet. But I'm going to angle this just a little. But when I do it in standing, now I've got to do it against my body weight, right? So it becomes a little bit harder. So hopefully you guys are doing this along with me. If you are, go ahead and stand up, and I want you to try to do the same, right? And it takes a little bit of practice. How do I get that to do that without my ankles, the tendons on the front of my ankle popping, okay? Here they are popped. I don't know if you can see that or not. There they are relaxed. And even mine kind of pop in and out too. So it takes a little bit of extra practice, okay? And in standing, just so you can kind of see it, the difference is here I am, my arch is rolled down, I'm pronated. Here's the dome, okay? So that's kind of what we want to go for. So it maintains that arch in the foot, all right? Now, how do we utilize this with dance? So that's in parallel. What I find a lot of times is as people go into their turnout, they want to force and use the floor. So we push those heels as far forward as we can, and then you straighten your legs up. Well, guess what? When I am forced into my turnout, no matter how hard I try, I can't get that dome. And it's because my foot is basically twisted on the floor. So going back, if you did my last workshop, we talked about not forcing the turnout through the hips, right? But making sure that I'm not forced, and I do not have great turnout anymore. So this is about where my natural turnout is these days. So when I do this, now I can dome. I can actually lift the arch up. So I go from being pronated to being able to lift into my arches, right? And that's really important to make sure that you are able to come out of that pronated position. If you can't get out of that pronated position, lessen your turnout a little bit, and I guarantee you'll be able to find it. So we can take that information now that we've got, okay, I can lift my arches. Now, when I go into something like a demi-plie, right, where if my arches are falling down, my ankles are rolled in, my knees are coming forward, and I'm not really, there we go. I'm not really able to utilize my turnout in this position. But if I lift through the arches, okay, I do my doming, My knees now can track, so let me see if you guys can get that angle. My knees can now track over the second and third toe, which is where we want to strive for. Now I can utilize my turnout muscles a little bit more than when everything is relaxed forward. So lifting those arches, pulling those knees back, getting the turnout to engage, that's how you functionally use that doming. The other way is when we go up into a releve or a heel raise, right? So if I'm not careful, and I'm just going to do one foot here so I can kind of show you. If I'm not careful, we know we want to avoid sickling, right? The other thing we want to pay attention to though, because, well, this is going to give me a lot of instability on the outer portion of my ankle. The other thing we want to pay attention to though is, am I overcompensating and winging? Am I over on that first metatarsal, that first toe too much, and I'm in a winged position? Because that's not good either. Now I'm creating a lot of compression here, stretching on the inside. So what I see when a dancer has the tendency to go into that overcorrected winging position, we get a lot of tendonitis out on those peroneals because it's being overused constantly every time you go up into your releve. Same thing if you're over sickling, we get a lot of that posterior tib tendonitis. So finding a neutral position in the releve is really important. So if I do my dome first, then I rise up into my releve, I should be able to avoid kind of either the winged position or that sickled position. So my goal for my weight is between my second and third toe. So right in the center of the foot, as I rise up into my releve, that's kind of where I am targeting my weight bearing, right? If I were to draw a line, and I do this sometimes with my patients, I will physically take a marker and draw a line up the center of the foot, through the center of the ankle, and up the center of the leg. And that line, when they point or go into releve, should be straight. It shouldn't be kinked one way or the other. So if you're having trouble finding it, go ahead, try and draw a line, and it will help. But doing the doming and then raising up into that releve will make a huge difference. So that's kind of alignment-wise what we want to strive for in the ankle, okay? So to build some extra stability. It's going to utilize a lot more muscle. So oftentimes it feels much more challenging to do, but you'll be using it correctly. So you'll end up building a lot of strength. So let me know, did you guys try, if you tried that exercise, give me a little comment over on the side there. Let me know if you were able to find the corrected alignment, if it was challenging for you. Kind of tell me how you're feeling with these as we go. All right. So that's the foundational exercise, right? We've got the doming. Now we're going to get into the fun stuff. We're going to get into the functional exercises. And again, all of these exercises I did format into a 4-week program. So if you're not sure, how do I actually program this and do these as an actual exercise routine, go get that program, because it will lay it all out for you. But okay, so we're going to start with some strengthening I'm going to show you the intrinsic muscles first. So the little guys in the feet, then we'll go up to the extrinsic muscles. Then we're going to take it up to the hips. Okay. So number one was doming for the intrinsics, which we already did. The next one is going to be something called tennis ball melting. So this is a lacrosse ball. You can use a lacrosse ball or a tennis ball for this exercise. They're both about the same size. And what we're going to do here, our goal is to work the little muscles in the feet. Okay. So I'm going to take this tennis ball. I'm going to put it right under the ball of my foot, and I'm keeping my heel on the ground, okay? And I'll show you from the side and the front. But what I'm trying to do here is I'm trying to grip the ball. So I'm flexing my toes over the ball, gripping, and I'm thinking of melting my entire foot around the ball, even like the sides of my foot. Melting, and then I'm going to lift the toes up, and I'm separating them apart as I'm lifting. So I melt, I lift up and separate. Melt, lift up and separate. Good. And as as I do that, so when I come from the like lifted and separated, I kind of, as I come over the ball, I almost think of reaching my toes out and down, okay? And you'll kind of feel that when you do it. So when you do that, a lot of times people will say, ooh, I feel cramping in my foot. That's good. That's normal. That's just those little foot intrinsics working. And you're right. And it's exactly right that they do almost feel like they're trying to cramp up when you do that. So no need to worry if that's what you feel. That's a pretty normal response. Pain is not normal, but with any of these, but cramping is pretty normal. So that's one way to work the intrinsics. Another way is something I call toe gymnastics, or I've heard it called toe yoga as well. So this one is trying to lift the toes one at a time. So I'm going to take my big toe and then I'm just going right up one at a time until the pinky, and then they come down one at a time. Now, as a dancer, I would hope, I'm like watching my toes in the video because this one's hard for me too. But as a dancer, I would hope that you can do this. I would hope that you can isolate out each of those little muscles, right? If you're having trouble doing that, it says to me that those intrinsic muscles are really weak. I have some dancers that they can only lift all their toes up and down at the same time. That's definitely an issue because as a dancer, you're barefoot a lot of the time, or you're in very minimal supportive shoes, right? A pointe shoe doesn't really have any support to the arch at all. And definitely not a ballet shoe. So making sure that you can control each toe is really, really important. It will help you with your balance because you'll be able to grip the floor a little bit more. You'll find your stability is a lot better once you strengthen up the intrinsics. And definitely you won't feel as wobbly in the ankle either. So yeah, that is toe gymnastics, right? Up and then down. Okay, so you've got options for intrinsic strengthening. We've got doming, we've got the tennis ball melt, we have toe gymnastics. And then the other thing, so I know I said I'm not a huge, we're not going to do a lot of TheraBand stuff, but I am going to give you a couple TheraBand exercises, which I'm sure you already know how to do. These are pretty classic, but I do just want to go over how to do them properly before we get into the higher level exercises, because I know that dancers are doing these, right? They're very common in like a pre-point conditioning class. A lot of people will keep their TheraBand right in their bag. So you should know how to do them properly. And truthfully, they do provide a good amount of strengthening for the intrinsics. The reason, though, that I don't keep people on the TheraBand exercises for that long, and you'll see in the 4-week program, I don't think they go past week 1, really. It's just to teach you the motion, teach you how to use the muscles, and then you've got to move on, because when we do a TheraBand, right, my foot, it's not on the ground. It's not planted. It's what we call open chain, okay? You don't dance and get injured in the open chain position. Yes, you point your feet, but that's not usually when you get an injury. The injuries come when you're standing on it. This is called closed chain, right? And most of our functional movement on a day-to-day basis is closed chain. We're standing on our feet. That's when the injuries happen. That's when you roll an ankle or fall or whatever causes the issue. So only doing TheraBand exercises will not provide you enough strength and stability to really prevent any sort of injury. Okay, I'm going to say that one more time. Only doing TheraBand exercises will not give you enough strength to prevent injury or really to build any, it's not going to build any strength. We've got to do the next round I'm going to show you in a second, which is the weight bearing. But let me at least show you how to do these properly, because they do have their place, okay? So the first one is just plantar flexion, so pointing into the band. Okay, so when I do plantar flexion, I like to break this down into 2 different motions because I like to make sure that I'm getting those intrinsic muscles, okay? So the first step is pointing the ankle, but not the toes. So this is like going into a releve, right? Then I point the toes. Then I slowly bring the toes back and then the ankle. Okay, so we're just isolating that out. Ankle, toes, slow on the toes, slow on the ankle, right? I don't want to just pop the toes back. That's not using any sort of strength. And same thing in the ankle. I want to do it nice and slow and controlled. The other thing that I am paying attention to, which you probably can't see from this angle, but I am making sure that I'm not sickled or winged, right? I'm making sure that my foot, remember that line that I talked about, I'm maintaining that same line the entire way through the motion, okay? The other common one that we'll see is inversion and eversion, okay? So in and out. When you do these, again, not bad exercises to do, but I do tend to see people doing these incorrectly a lot of the time. So you have a couple different options. I'm actually going to tie my band in a loop here. I like to do these more as an eccentric or slow controlled movement. So if we put this around the foot, okay, so eversion would be pulling out into the band. Now, if you're having a hard time doing this with just the ankles, because I don't want the knees to move, right? I want just to be the ankles. What you can do is bend the knees and keep the heels on the ground. Now you'll be able to move the feet in isolation a little bit easier without the knees going with it. But when I do this, I want to go nice and slow and controlled, okay? So I'm going to get some tension on the band. I'm going to evert out, hold it for a second, and then slowly release it back in. And it is okay if you release it back into a sickle, because then you just have to go a little further into the movement, so you're going to get more strength. So I evert, hold, and slowly release. That slow eccentric, you're going to feel that burn. That's how I like to do those, instead of in and out, where you're working it, but it's not giving you the control that we're looking for. Same thing if I wanted to do inversion or coming in. So you have a couple options. You can have somebody hold this band here. You could tie it to something sturdy, or I can use my other foot as an anchor so that I can do the inversion. I'm just going to hold it here so you guys can kind of see it. Okay, so when I invert, same thing. I'm pulling in and then holding and slowly releasing back. Okay. I wouldn't recommend holding like this. I would definitely do, my band's a little short for this, but I would definitely do the foot anchor so that the resistance is coming from straight over at the side versus up. So if you are going to do TheraBand exercises, again, that's just want to make sure you guys are doing those properly to get the most bang for your buck out of them. All right. So that's all the intrinsic strengthening, and TheraBand gets a little into some extrinsic strengthening as well. Now we want to get into your weight-bearing exercises. So this is the fun stuff, okay? So we're going to run through a list of exercises. Again, each of these are broken down into that 4-week program for you. But we're going to utilize, we talked a lot about doming. Now we're going to use it, okay? We're going to make it a little more functional. Adjust, okay? All right, so my two favorite, most functional exercises, which are going to be considered a bit of cross-training for a dancer, but every dancer should be doing, are squats and deadlifts, okay? So I want to make sure that you guys know the difference between the two. If you did my hip workshop, we did talk about both of these and how to do them. Or check my Instagram page, because I talk about squats and deadlifts often, because again, they're very functional. So a squat being, so they both start with a hip hinge right here. A squat is where I allow my knees to bend and my butt to come down. And a deadlift, my knees are going to stay a little straighter and my trunk is coming forward. Okay. Now, how do these help the ankle? Well, they are going to do a lot of hip strengthening, which is great. The other thing is I'm going to use my dome while I do these. So I'm going to start with my feet. When you do a squat, a little bit of turnout is okay, but I don't want you to be all the way turned out. Just come to what's comfortable. I'm going to lift up into my dome, and then I'm going to go down into my squat. Now, if I'm using that dome correctly, my knees are going to track over the center of my foot versus this inward tip. See that pronation? That's what we're trying to avoid. So I'm using my dome, coming down into my squat, knees track over the toes, and then back up. Okay? So we're getting full leg strengthening out of this. We're getting hips, We're making sure the knees are tracking correctly, and then we're getting that doming and ankle stability. So that's how you use it with a squat. Same thing with a deadlift. I'm gonna do my hip hinge, I'm doming, I'm coming back with a deadlift. All the weight is gonna be in my heels. I should feel the pull in my hamstrings. If you do not feel the pull in your hamstrings when you do your deadlift, I want you to straighten those knees a little more and pop your butt up higher in the air. Now you should feel that pull, okay? I'm also making sure to get a nice hinge here. Okay, so if you aren't too familiar with the hip hinge, go back and watch the hip impingement workshop, because we talked a lot about hip impingement or hip hinging with that. So both squats and deadlifts, you can utilize that ankle strengthening, right? Okay, now I can take those exercises to the next level, and I can make them a little bit more challenging. So both of those were in double leg support. Well, a lot of times dance is in a single leg support, right? So, and actually I'm going to backtrack a little because I did forget to show you guys this one first before we did the squats. But if we go back to just the doming, so kind of your progression for doming is I do my doming and weight bearing. Now, can I do it on a single foot, right? Can I maintain that dome while I'm balancing and avoid that pronated position, okay? It's gonna be easier if you keep your knee a little bit bent. It's gonna be more straight. It's gonna be more challenging if I bend my knee and now try to keep the dome. You'll find that there's a lot more wobbling that goes on. The ankle will feel a bit more unstable, but you're having to use a lot more muscles. You're using everything in the calf. All sides of the ankle and the foot are active with this, okay? So just doming, go from 2 feet. Once you got that, progress into a single foot, okay? Now we can progress the squats and the deadlifts into single leg activities, okay? So for a squat, okay, so squat being our motion here, we're gonna do a single leg dip, okay? So I'm standing on 1 foot, working my doming on a single leg, and then I'm gonna bend and do basically a single leg squat, just enough till my other heel taps down, and then back up. Let me show you from the side. I'm doming, I'm coming back, hip hinging. So my butt's going back. Notice my knee is not coming this way, right? I'm hinging, so my knee is staying back. Down and up. Good. And I'm maintaining that dome the entire way through. You can also do this off the edge of a step. So I would stand on the bottom stair with this foot, my right foot would be hanging off, and I would just dip down. This heel, if I'm on a step, your heel does not need to touch the ground. It just allows you a little bit more range of motion to go into that dip a little further down. And you're trying to maintain the stability in the ankle throughout the entire exercise. One way to know if you're not stabilizing enough is if, just like with the regular squat, if you see that knee tipping in, right? As soon as my knee tips in, my arch falls down, I'm not using my hip muscles anymore. So I want that knee to stay tracking over the middle of the foot the entire way through. Okay? All right, so that's the progression of a squat. The progression of a deadlift would be a single leg deadlift. So these are called single leg, they're called RDLs, okay? And so for this motion, what I'm gonna do is I'm going more, remember a deadlift is hip hinging this way. So what I'm gonna do, I'm gonna be on 1 foot. I'm gonna come back into my hip hinging pattern. So the weight is in my heel, okay? And my butt is kind of coming backwards. And then I'm reaching this way towards the ground and back up. Now, at the bottom of that motion, let's see if I can hold it there. Notice my back and leg are in a straight line. I am not doing an arabesque, which is what a lot of my dancers want to do. They want to go more into like an arabesque motion. We don't want that. We want everything parallel and coming straight forward, okay? So if you look from the front, it's the same thing. I'm maintaining that dome. I'm going down into the deadlift this way. I'm not here. I'm not letting that arch fall down and the knee fall in. I'm keeping the hip muscles should get tired. I'm keeping them engaged. So if you're doing this properly, you'll probably feel the hip get tired, right? And then I'm reaching here. I can add weight into that, into either a deadlift on both legs or one leg. I don't have my weights in here right now, but I would just hold the weight in front of me here, or I would hold like a free weight almost kind of in that position and then go down into my deadlift that way. I don't recommend adding weight into these until you're a little bit further out and you've learned the movement. You always want to learn the movement first, then you can start loading the movement, okay? And again, that is laid out for you when you would start implementing weights. It's laid out in that program for you. Okay, so we've talked about some pretty functional things here. We've got squats, we've got deadlifts, both of those on two legs, and then progressing them into a single leg. I want to talk a little bit about progressing your balance, right? Because strength and stability in the ankle, a lot of it comes down to balance. So what are some variations that you can do to make that a little bit more challenging? Well, for one, we already talked about making sure you've got your doming, right? So you can still, that's going to be the same, right? I'm still going to dome on one leg. Straight leg is easier, bent leg is harder. Now there's lots of different things that I can do to this. One thing I can do is maintain that position. I like to tell my patients to go into like a soft knee position, right? Make sure you can see my leg here. So this standing leg is just like softly bent. It's not hyperextended, but it's not like in a full squat. It's just soft, right? So if you go into that soft knee flexion, then one thing I can do is close my eyes. Without having that visual cue of, being able to find something to focus on, can you still sense the awareness to maintain the dome in your foot and maintain your balance? If you think about for dancers, a lot of times you're dancing, there's different lighting and the stage goes dark sometimes, or you're just in the dark in the wings. So can you still stabilize the ankle when you don't have a good visual cue? That's a huge piece of balance. So practicing with your eyes closed is really, really important for dancers. Practicing on an uneven surface. Same exact exercise, just do it on a balanced ball or a pillow. You can, if you're, again, at your home, use a pillow or rolled up towel, carpet, whatever. You can stand on your bed. That's really hard. But changing the input on your foot is going to challenge your balance a lot too. Now, the thing to keep in mind there is, no, you're not usually dancing on an uneven surface. However, if you're overtraining yourself to be able to balance uneven, think about how much stronger it's going to be when you are on a nice flat surface. The other thing that with balance that I like to do for my patients is have them on that single leg. Now just change your focal point with your head. Okay. So balancing, soft knee, maintaining the dome. I'm going to look right and left. And the goal is not to fall over, right? Right and left. While maintaining your dome. Don't forget about that part. You can also do looking up and down. Okay. Another really important thing for dancers, because you're changing your focus often throughout a dance. Very rarely are you looking straight forward. So those are some easy ways that you can just challenge your single leg support a little bit more. One of my other favorites. So this is a combination of some hip strengthening as well as a balance exercise. I'm going to show you first without the TheraBand, and then I'll show you how you would add in some resistance, but is doing a standing twist, okay? So for a standing twist, I'm going to go back to my single leg support, okay? What I'm going to do is I'm trying to make sure that the knee stays over the middle of the foot the entire time for this exercise, but making my pelvis rotate out and towards the leg. So away from the leg and towards the leg. But while I'm doing that, I'm making sure the knee stays pressed out. So this is the hard direction. What it's going to do when you go that way, if I'm not allowing the knee to pull in and the arch to fall, I'm keeping it pressed out, I'm utilizing my turnout muscles. So now I'm getting a hip strengthening exercise and an ankle exercise all in the same thing, okay? So I'm on one foot, I'm rotating out and in. Good. And you should feel that hip firing as well as the ankle. If that's too easy for you, you can make it more challenging with a TheraBand. Now, I don't have a way to demonstrate this to you, so I'll just kind of show you what I would do. I would do this standing next to like a stair banister or a door handle or something, and I would anchor that end to a door, okay? So we'll just pretend that that's anchored there. Then I'm just gonna hold the TheraBand nice and tight to my belly, okay? So the TheraBand isn't moving, so you're like this, right? TheraBand's not moving. I'm just gonna take a step out so I get a little resistance on the band, and now I'm doing the rotation in and out. So my band is anchored, and the band is trying to pull me off balance, right? And I'm having to fight it. So usually what I'll do is I'll do 10 times here, then flip around, door is still over here, do the exact same thing so that the resistance is coming from the opposite direction. And then you would switch and do the same thing on the other foot facing both directions. That's one of my favorites to hit a lot of different things. So yeah, that's the standing twists. All right, I'm gonna look at my cheat sheet here, see which ones we haven't gotten to yet. Yes, okay. All right. So another good progression for like we talked about doing squats and the single leg squats. The other really easy thing to throw in there, which will be ankle stabilization. A lot of people don't think about this, but lunges, right? Again, lunges work a lot of things. They work your core, they work your hips and your thighs, quads, hamstrings, and they are going to work ankle stability. So it's a very, very functional exercise that we don't typically think about for ankle strengthening, but it is, right? So I'm going to do it in place, right? I want to be popped up, nice wide stance. My back heel is up, and then I'm going down into my squat or my lunge here and back up. And the goal when you do these is that you hit a 90-degree angle on this knee and a 90-degree angle on the other knee. Here, okay? Now, from the front, I am making sure that that foot is domed. So as I go down, I'm getting none of that, right? Knee over the middle of the foot and then back up. I'm also getting a ton of stabilization on this back ankle because it's staying popped up in the air. So I'm getting a lot of stabilization there, okay? So that's one way that you can progress. I usually will progress from a 2-foot squat to a lunge or that single leg dip, either. I think the lunge for some people is harder than the dip. I think it just depends on where your weaknesses lie. So you can kind of play around with that. So that's another good one. And then I do want to move up a little bit more into some hip strengthening because again, the hips are going to provide most of the support down in the ankle. So it's really important that we hit on those hip exercises as a functional thing. So I'm going to grab my band again and tie it back in a loop. So these next two things are going to utilize your band. Okay. So one of them, side steps. Now, a lot of people will put, for a side step, you can put the band up around your knees, but we are trying to work your ankles, right? We're trying to get ankle stability here. So I'm going to put it around my feet. Okay. Go this way. All right. I'm going to come down into a little like athletic squat position, and then I'm going to do my side step. Okay. Now, because the band's on my feet, I'm having to use those muscles to control a lot more motion in the band than I would if it was up around my knees, right? Most important thing with the side steps, as you do it, you want to make sure the knee stays tracking over the middle of the foot. I'm also not allowing myself to lean my trunk, okay? I'm staying square, and it's just my legs stepping in and out, okay? Nice and slow, so you get that single leg balance time, right? I'm on a single leg, slow, bring it in. Single leg, slow, bring it in. So side steps will work. Again, that's a way to incorporate the hips and the ankles together. The other way that I can incorporate hips and ankles is doing some abduction. So you can do this tied this way, or you can attach to like a pole or something, a banister or something. I usually just will do it this way. I also would recommend when you first do this, have something to hold on to, have a countertop or something that you can hold, because what you're going to do is abduction, which is a little bit, come back here so you can see me. I'm coming on a diagonal back and forth here, okay? So from the side, I'm just at a very slight ankle backwards. Good. So I'm working the hip here, but I'm also working the hip and the ankle on my support leg, right? And as always, I'm making sure I've got that dome the entire way through. Now I've turned this hip exercise into a balance strengthening exercise as well. That way. So those are hip abductions. All right. Okay. A couple other things, just kind of targeting the core and the hips that don't really involve the ankles. Again, this is a really good thing that you still want to incorporate for ankle stability, but doing things like clamshells, which you guys probably know. Again, we did this in the hip workshop, but just working the turnout this way. You can do a regular clamshell. You can also do an advanced clamshell this way. My hips are staying stacked. I'm not rolling, but I'm utilizing the turnout muscles. I can progress that because really a dancer shouldn't be doing clamshells for too long. They're going to feel pretty easy pretty quickly. So you want to be able to progress that. And again, this progression is laid out in that 4-week program of how you would progress this. But you can go into eventually a fire hydrant, right? So taking the leg this way. I'm still doing the same motion of the clamshell. I'm not allowing my hip to open up. I'm just rotating here. Again, not utilizing the ankles in this exercise, but still needing that core stability for it to carry down into the ankles. A really advanced progression would be doing a plank with a clamshell or a fire hydrant. So going into your full plank position here, passe, and then turn out. So doing a plank clamshell. Again, a very advanced level of that, but it's always good to have somewhere to go with it. You know, they're going to get easy, so you got to make them harder. So that's another one that I really like for just core and hip strengthening. And then the last one for that. Oh, you know what I did forget to mention too? I forgot I wrote this down in here. The fire hydrants. I don't know if you guys have ever done leg circles with the fire hydrants. That's another really good one. That's a glute burner. So when you're in this position, going in a circle. And I'm not allowing my back and my hip to move all over the place. I'm nice and stable, utilizing that bracing and coming around, and then you can reverse it as well. Okay, so that's a good progression. Definitely burns the glutes. And then the other one was bridging. So a couple of variations on the bridge. This is going to work more the glutes and the hamstrings, which will again carry down and give you some support into the ankle. But a couple variations, so you have them, would be just, your standard bridge would be here, but you can add a heel raise, right? So I can go into my bridge, and then I could either do alternating. And again, I'm making sure that I'm not sickling or winging, so I'm neutral. Or I can do both legs, or I can do it all at once. So I have a couple different variations there in adding in some ankle things. I can also, to target a little bit higher into the hips, I could do a bridge with a march. So I am getting some single leg support and really having to work one hip at a time. I could do just a full single leg bridge. This is going to work the ankle a little bit more than the other ones, right? So all of those different variations are going to hit on those really important stabilizing muscles. All right, so we talked about a lot of different exercises. I think the only one that we didn't really, I lied. There's one that I didn't get to, just a standard heel raise. Let me also just kind of review that because that's a common one that you'll see people doing. So for you guys, it's releves. For everybody else, they're called heel raises, but just straight up and down, right? And working that, it's going to work the calf muscle. There's really good progressions on these. So you would want to start with your double heel raise. That's going to get pretty easy, probably quickly. So how do you progress it? We can do eccentric heel raises. So up on 2, down on 1. And that was a bad one because I fell down. But you want to go nice and slow. So up on 2, slowly down on 1. 2, 1. And I usually do all to one side and then I'll switch and do the other side, trying to maintain that doming throughout. You can also then, so once you can do eccentric lowers, then you can progress to just a single leg heel raise. You can also do it with your heels hanging down off of a step. So you have a much further range of motion to go. So any of those variations on that releve or heel raise, I generally will give this to people for strength training when they have an ankle instability issue. Even though you're doing it in dance, I still want you to do it outside of dance regularly to build up more strengthening and stabilization. Ideally, you want to be able to do at least 30 straight through without a break. And surprisingly, a lot of dancers still fatigue before they get to that 30 benchmark. So make sure you can build up some endurance in the muscle and you can do them repetitively. All right, so lots of ideas for strength and stabilization. The only other thing I want to just touch on really quickly is recovery afterwards. So you're doing all these awesome, functional, difficult exercises. How do you make sure that you're not contributing to pain or discomfort? You do want to make sure you tie in a little bit of mobility work. So generally, I'll have people do this after all of the strength training at the end of their workout. Just do some nice, gentle mobility. So mobility being some static stretching. You can do a gastroc stretch, so calf stretch here. My foot with this one, I'm making sure that it's my toes and heel are in a straight line. I'm not turned out. All my dancers like to turn out. Don't let it happen, okay? So that's gonna do gastroc. Soleus is a muscle underneath that. If I walk that back foot in and bend this way, you should feel the stretch a little closer into the ankle. Some people will feel this, some people won't. It just depends on where you're tight. But ideally, after a good calf workout, you want to stretch both of them. You can also do it kneeling. So if you get into like a deep kneel, I'll go this way so you can see me here, and then kind of lunge forward on it. I can do it back here too, here. So I'm stretching into dorsiflexion this way. This is important for dancers. You spend so much time up in releve, these calves get short and we lose a little bit of our range of motion into dorsiflexion. So it's important to get that motion back. So that's to stretch. That's like a kneeling calf stretch. You can also flip it around and do an anterior tib stretch. So if you remember, anterior tib is on the front. Sometimes that muscle gets really tired with all those heel raises and releves. So I just flip my foot over here and just kind of rock back into it. I'm being extra careful and cautious of this one. I am not putting too much weight through that foot. I don't want to overstretch those ligaments. I'm just leaning till I start to feel the pull, and that's it. I don't have my full weight through that foot. You can do some foam rolling. So, foam rolling just kind of up and down the calves. The other one that I like to do is if you are really tight in the calves, find the spot where it hurts, hold the pressure there, flex and extend the foot, and you'll feel that trigger point kind of rolling back and forth under there. Feels pretty good. You can also go side to side. And if you need more pressure, use the other leg. So a lot of different options with the foam roller. And then if, you know, in your workout, if you have hit a lot of hip muscles, don't forget, still stretch your hips. You know, you can do that figure 4 stretch here like that, because a lot of the turnout work, you're going to feel that fatigue up in that muscle, or the single leg activities, you're going to feel the fatigue up here. So you definitely want to get some stretching for the hips, some hamstring stretching. You can do a pike stretch, however you want to stretch your hamstrings works. But don't forget about addressing those muscles as well if you've put some hip strengthening into your daily workout. All right, so again, ton of information today. I tried to jam pack this workshop with so many different options for exercises for you guys, because they are really important. And the biggest thing that I want to reemphasize is that it's all about making sure they're functional, right? So just using the TheraBand is not going to give you the same effect. We want to build a lot of strength in that ankle. So anything functional, weight bearing is what's going to do it. Adding additional free weights and things is going to be really important. Again, because this was so much information and I wanted to make sure that it was doable for you guys to put into a regular routine, that's why I wrote up that program for you. So if you are interested, again, it's $11.99. It's a 4-week step-by-step program. It's a 3-day rotation. And it lays out how do you actually do all of these exercises in a progressive routine for 4 weeks. And so by the end of those 4 weeks, you guys should be feeling pretty strong in the ankles. So I definitely would encourage you guys to head over. Again, I'm going to email you the link to it. So if you are interested, that should be an easy thing for you guys to follow along with. So I do just want to, we're done with all the content, but if anybody had any questions, I'm going to stay on here for a second. Please just put them over in the comments box there, and I'll go through and I can answer any specific questions that you guys had. Let's see. Oh yeah, hard not to pop out the tendons on the way down from releve. So, okay, so when you're doing, we talked about not letting, when you do the doming, try not to let the tendons pop. It is okay if they pop when you go up and down into your releves or your plies, because keep in mind, when you are moving into releve or plie, you have to use the extrinsic muscles. You can't only use the doming. So it is okay if during that releve motion, the tendons are popping in the front of the ankle and it's not staying relaxed. They're not supposed to. That really is just for when your foot is planted on the ground and you're just doing doming. So that's totally okay, Sarah. Let's see, Daisy, is it normal to feel more stiffness in the ankle range when doming? Possibly, yeah. It depends on your limitation. So everybody is slightly different. For some people, they have a lot of limitation in the range of motion in the ankle. So doming is very challenging. If that's the case, then you're somebody that probably would want to focus a lot on those mobility type exercises. And there's many more. We didn't even get into a lot of those. That's a whole nother workshop. But you may just need to focus a little bit more on mobility. You also may need to do some mobility before you do your strength training. And that's okay too. There's nothing wrong with doing a little bit first and then a little bit at the end as well. So that's just fine. All right. So it doesn't look like not too many people had any questions. I suppose that's a good thing, right? But please, if you guys do think of anything later, or you have questions about that 4-week program, don't hesitate to reach out to me. My email, I'll write it in here. It's jenna@onpointwellness.com. All right. So there's my email if you guys have any issues. I assume that you all have my Instagram because I think that's how pretty much everybody registered, but it's just @onpointwellness. So follow me over there. Okay. Oh, looks like a couple more questions. Let me see. Going into a squat feels more restricted when focusing on doming. Yes, that is a very good point, Daisy. And that's true. Your range of motion will probably feel a bit more restricted. And the reason being is the reason you can get further into that squat when you don't dome is because you're getting the range of motion from the where we don't want it, right? I can get further if I let my everything tip in. I can get there easier, but that's not good for me, right? I want to be able to correct it. Now I may be more limited, but as you get stronger, you will be able to get that range of motion back. So that's a really good point you bring up. Don't let that frustrate you. It is very normal. You still don't want to you don't want to lose the dome. You still want to try to maintain that good arch in your foot throughout the entire movement. All right. Oh, good. Okay, perfect. Very helpful. Okay, good. I'm glad that you found it helpful. Absolutely. Yeah. So again, please let me know if you guys do think of any other questions after this. Send them my way. I am working on another hip workshop. I know that seemed to be the hot topic that everyone was the most interested in. So we are going to be doing I'm working on a workshop as well as a program similar to the 4-week ankle program to increase your leg height. So increase your développé. That would include things like getting rid of the popping and the pinching during développé. I'm also looking at increasing your turnout program. So these are topics that will be coming up. So stay on that email list. You guys are all already subscribed since you registered. So stay subscribed and you'll get the updates for when there's new programs coming out. Like I said, the next one that I'm looking at is doing another hip impingement, snapping hip, increase your développé height. That's kind of the next topic. So stay tuned. And I hope to see all you guys soon. We'll see you over on Instagram. And reach out if you need anything. Hope you all have a good day. Bye.